Well, welcome to Ask an MS Expert Veterans Program. My name is Emily Riley, and I am the moderator for this wonderful program. I'm a proud Air Force wife, dog mom, certified personal trainer who teaches adaptive fitness classes for the MS community, and I've been living with MS for over 17 years. I'm currently located in Southwest Illinois at Scott Air Force Base. Thank you for joining us as we celebrate MS Awareness Week. Today's program is brought to you in partnership with the Veterans Affairs Multiple Sclerosis Centers of Excellence, the Paralyzed Veterans of America, and the National MS Society. Ask an MS Expert Veterans Program offers a place to connect and ask questions to experts on topics impacting veterans affected by MS. We will also highlight important resources and services available to veterans. MS navigators are online answering questions and providing resources, so please post any questions or comments that you may have in the comments box on YouTube. People who serve in the U.S. military serve in many ways and on many different fronts. And thousands of these veterans also face a unique challenge, multiple sclerosis. Dr. Mitch Wallin and Dr. Culpepper will join us today to talk about who gets MS, risk factors, and military service connection. We will also share resources available for veterans living with MS, and we'll talk about the new Promise to Address Comprehensive Toxics Act, better known as the PACT Act. So let's meet our experts. Dr. Mitch Wallin is the director of the VA MS Centers of Excellence East and associate professor of neurology at the University of Maryland School of Medicine. Dr. William Culpepper is deputy director of the VA Epidemiology Program, Health Outcomes of Military Exposures. He is associate director of Epidemiology and Informatics at the VA MS Centers of Excellence East, and he's an adjunct professor of neurology at the University of Maryland School of Medicine. Dr. Wallin and Dr. Culpepper have been studying the connection between military exposures and MS for over 2 decades. Well, welcome, and thank you for being with us today. All right.
Thank you.
Yeah, so let's jump in and talk about MS and what we know so far. So Dr. Wallin, how many people live with multiple sclerosis, and is it more common in men or women?
Good starting question. Joel and our group that was sponsored by the National MS Society took a look at this and used data from 2010 to cut to the chase. And in 2019, we estimated there was 1 million people with MS, just under 1 million people with MS in the United States. And so we used basically an algorithm we developed and applied it to the major insurance pools in the country to come up with this number. And that's a short answer. We used the 2010 census as the core data, and then we adjusted it to the more current census increases between 2010 and 2019. So that's the overall number. And regarding your question about sex, women are more likely to get MS than men. And the ratio, at least in the prevalence data, is about 3 to 1, or between 2 and 3 to 1, generally in North America and Europe, depending on the population you look at.
Okay. Now I've heard different terms. So can you tell us a little bit about the difference between incidence versus prevalence of MS?
Sure. So they're both terms of frequency of a condition or disorder in a population. Incidence is the number of new cases of a disease over a given period of time. Usually it's measured over a year. And prevalence is the proportion of individuals in a population that have a given disease. And here, in this case, we're looking at MS over a given time. It's really a ratio. Incidence is really a rate and more of it's a little more challenging to pick that out of a population. But prevalence is the all kind of new and old, and incidence is new.
Great. So Dr. Culpepper, do race and ethnicity affect who gets MS?
That's an interesting question. Whether or not race or ethnicity affect who actually gets the disease is a question still to be answered. But what we do see is a difference or a change in the distribution of those that do get MS. Historically, MS has been thought of as predominantly a Caucasian disease, particularly those of Scandinavian descent. As John Kurtzky and Dr. Wallin have studied military cohorts over the years, and then our work with the Gulf War cohort, we've seen a shift in that the incidence is increasing in African American populations relative to Caucasian populations, and that has been borne out in with some of our colleagues looking in Kaiser, Southern California, and a few other. And so is this change, in distribution. The exact causes still remain elusive, but it is something to be aware of. And I think that from a clinical standpoint, we are aware that we do see a more aggressive disease course generally in African American patients compared to those of other races.
Interesting. So, Dr. Wallin, we received a question from Karen about genetic risk. Karen lives with MS and her mother also has MS. So Karen is kind of wondering if she inherited it from her mom.
So it's a good question. We think that genetic makeup is really important in terms of MS risk. It's one of the factors that in part drives it. And most of the risk is in large studies is around the HLA locus. This is the immune-based susceptibility genes, specifically the HLA-DR genes that are probably driving a lot of the risk. There have been over 200 alleles, small groups of genes that basically have conferred an increased risk for MS, but the HLA part of the genome is the significant part. And roughly 10 to 20% of people with MS have a primary or family member, primary family member with MS. So a sibling or a mother or father. Most MS tends to be sporadic. In other words, there's not a strong family history, but it can occur. It's not a gene association like you see with other conditions that are dominant, like Huntington's disease or other conditions that just have one specific area that affects or impacts the disease. It's a complex disorder with the HLA being the major part. So we can say that the risk is slightly bumped up if you have a primary family member with the disease compared to being sporadic without a family history. But the genes are important, and we're using these to try to model the course of the disease and also look at drug gene interactions.
Kind of on this similar topic, Dr. Wallin. So what are some other risk factors for MS if in addition to potential genes?
Good question. I mean, I think we're starting to uncover some significant risk factors, specifically things that we can control. I will say most people have heard about the Epstein-Barr virus story that was put out in a science paper about a year ago, and some mechanistic studies that have also come out to show that Epstein-Barr is a risk factor for MS. Typically in North America and Europe, Epstein-Barr is a disease of adolescence and known as mono, and it's spread through saliva. In most of the world, however, it's acquired during the first few years of life. So, but something about the way it's acquired in the North America and Europe kind of drives, I think, the MS disease risk. And there's been a number of very classic studies done with military cohorts and other cohorts to show that you, by and large, have Epstein-Barr before you develop MS, and the titers increase before you have your first symptom onset. So Epstein-Barr, likely a viral risk, whether it's causative is still debated. Smoking, like is a risk factor for so many things, is a risk factor for MS onset, also MS disability. We know that insufficient sunlight and or vitamin D deficiency is a risk factor for MS onset. And obesity in a number of cohorts, including pediatric MS and adult MS, is a risk factor for onset. Those are some of the major ones. Yeah.
So now that we kind of have a little bit better background of like MS and who gets MS, let's kind of turn our focus to the veteran community. So Dr. Wallin, do we know how many veterans are living with multiple sclerosis?
So that's a good question. I think we monitor the VA population quite well with our centers that we have. And I'll just give you a couple of caveats because it depends on what kind of time points you're looking at and how you look at people over time. So in any given year in our VA healthcare system, there's about 20,000 veterans with MS that have an encounter, they touch the system, the healthcare system in some way, whether it be just in neurology or some other clinic. And that's the numbers we have nationwide. If we go back and look at the numbers over the past 2 decades, there's approximately 55,000 veterans that we know about. Some of them have passed, but that's actually a cumulative number over 2 decades of 55,000. So those are the ballpark numbers. There's probably a slightly higher number because we know that not all veterans that live in the United States actually utilize the VA healthcare system. At least 8 to 9 million we know about out of the roughly 20 to 25 million veterans that are living in the United States. So there's probably more than that number, more than that 55,000 that are living in the United States that are U.S. veterans that are just not using the VA health system.
See. So when you look at the different military branches of service, is there a difference in MS incidence?
So the short answer is we did find a difference, and this is from an incidence paper when we studied Gulf War era veterans between 1990 and 2007. So there was higher incidence rates in the Air Force, the Army, and the Navy compared to the Marine Corps. We could, you could have some speculation about why that would be, but there is some differences based on the service branch you're in and the risk for MS. So we have to drill down and we can talk about, what may be driving that, but that's for further study. So so generally the Marine Corps had a lower incidence of MS than the other services.
Interesting.
Would just add to that with the Marine Corps, that's probably the most physically demanding of the branches, and so there's a greater degree of scrutiny. So I just caution less reading too much into this branch related difference in MS at this point. I think there's still some work to be done to try and unravel if that's a real effect or is it just the nature of the branches, and we're doing a better job of screening out, those that may not be the quote unquote fittest for the military.
See. So we know that there's a lot of information out there about veterans living with MS. Some of it is accurate, but then some of it is not. You both have led a lot of research that looks at the connection between military exposures and MS. So let's talk about your findings and let's debunk some of the myths that are out there. So Dr. Culpepper, I'll start with you. So myth or fact, veterans are more likely to develop MS than non-veterans?
We have no compelling evidence to suggest that is the case. As Dr. Wallin noted earlier, when we did our work, looking at the nationwide prevalence of MS, and we looked in the VA compared to, the commercial claims population, the actual prevalence was lower amongst veterans than the other groups, not by a large extent, but a little bit lower.
Okay.
So that does not lead us to believe that and we've not had other evidence to suggest that we see a large increase in the veteran population compared to the general population.
Okay, so myth then.
Yes.
Dr. Wallin, so Crystal's wondering if there's a higher prevalence in women veterans versus men veterans.
That is true. It's dependent on the year you look at. It's between 2 and 3 times higher in women compared to men, and that echoes kind of a similar ratio in the general population.
Okay. So Dr. Culpepper, myth or fact, developing MS is connected to being exposed to Agent Orange during the Vietnam War. I've heard this one a lot, so I'm really curious what your answer is.
Myth. Our office has taken a look into that on several different occasions using registry data as well as healthcare claims data, survey data, and consistently have found that the Vietnam veteran population had rates lower than what was published for the general population and lower rates than their veteran counterparts that never deployed to Vietnam, but are of the same era.
Okay. All right, Dr. Culpepper, back to you. Myth or fact, there is a connection between people who served in the Gulf War and MS.
Again, that is myth. Dr. Wallin and the late Dr. Kurtzky and I have published a series of papers, specifically on MS and the Gulf War I cohort, and found actually a lower rate of MS in the deployed versus the non-deployed. Even when we look specifically at those that were at Camisea, where some of the chemical weapons were destroyed, we saw still a lower overall risk of MS in this group. And I think probably what we're observing in both of these combat-related populations is what we refer to as a healthy soldier effect. There is a screening process for fitness to get into the military, and then there is an additional screening process for fitness of those that actually will be deployed into a combat environment. So I think there's some pre-selection, and we see this regardless of the particular health outcome that we may be focused on, is that the deployed are typically a little healthier, or at least early on, than the non-deployed, and that the military population overall typically a little healthier than the general population.
Interesting. All right, Dr. Wallin, this one's for you. Myth or fact, vaccines like malaria, hepatitis A and B contribute to the development of MS?
So that's a myth. I think that at least for most of these major vaccines, there was some attention about maybe a decade back with the hepatitis B vaccine by some preliminary data in France, and a number of population-based studies showed that there was not really a signal there. Similar with other vaccinations, most recently with COVID, I know that vaccinations sometimes can be associated with a relapse in some cases, but in terms of a major change in risk for developing a disease like MS, there's not a clear evidence when the studies are really done at the population level.
It's really helpful. I think the saying of knowledge is power is very true. And so I think just kind of helping debunk some of these myths is really helpful for people to be able to move forward without some of those fears or questions. So Dr. Wallin, so what are some new studies that you're working on, and how do you think the outcomes are going to impact veterans living with MS?
It's always good to look at new things. And I think we are looking at broadly looking at infections before onset, trying to understand if there's a unique aspect within veterans across the board, men, women, and racial kind of predilection. We're looking also at the HLA genome and looking at that aspect and the subtleties therein and risk for MS onset. We've also done quite a bit of work over the years on telemedicine and telehealth within our system to see how we can widen our expertise to folks that maybe live a long distance away or can't get into our centers. I think everybody was actually had us blowing up on telehealth during the pandemic. They liked it or not. And so, but I think we see that too as a way forward to improve our access to MS expertise and therapy and the multidisciplinary care that we try to deliver, trying to do more things through remote means where possible.
So great. Yeah, your research is really impacting veterans. It'll be exciting to see the more things that you all help us better understand. So symptoms of MS often occur years before diagnosis. So if a veteran is diagnosed with MS within 7 years of their separation from the military, the VA may classify it as related to military service, which is also called service-connected disability. So Dr. Wallin, what types of benefits does someone receive if their MS is service-connected?
A good question. I think there's a rating system, and I will just clarify that the VA sometimes can get lumped into different spheres, but service connection and compensation, that part of the VA is called the Veterans Benefit Administration. The healthcare part of the VA is called the VA Healthcare Administration. So they're related but separate. But VA disability compensation is the biggest benefit, where you get a monthly tax-free payment based on the degree of your injury or illness. So that's the main benefit. There's also benefits in terms of housing grants, assisted living, employment benefits, and beyond the service connection, if you're homebound, there's a number of benefits for aid and attendance. So those are the major ones. But getting your care basically for your disease, in this case MS, or things that are related to that, is probably the biggest benefit. And we try to encourage people to get service connected, and we in our clinics offer assistance in documenting symptoms to do that.
Great. So Dr. Culpepper, can you explain how the time frame of 7 years was determined for MS connection?
Well, that's a question we wondered about as well. The designation of MS as a service-connected disability and the criteria surrounding it were made several decades ago, certainly before I joined, the MS Center. But what I suspect is that, if you think of a service member that does one tour on active duty, separates at about 24, 25 years of age, you add this 7-year window, that puts them about 31, 32 years of age. And that's kind of the midpoint of MS onset that we typically see. We typically report late 20s, early 30s as the predominant age of onset. So that's my speculation. I don't know if that's, accurate. I think the important point for veterans to be aware of is that you have this 7-year window in which you have to document symptom onset. It may be the case that you're not filing a claim until 15 years afterwards, but as long as you can document symptom onset within 7 years of your discharge, then you meet the minimum qualifications. And certainly reaching out to the PVA can assist, with the necessary documentation, other criteria that, may be important, and actually assist you in physically filing the claim.
That's really helpful to know for people with that time frame. Sounds like it's really important. So Dr. Wallin, Lisa knows her MS symptoms began when she was serving in the Army 3 years ago. So how should Lisa find out if her MS is service connected?
So I would say if she's still on active duty, she can go through, and there's questions. The vet service organizations are incredibly great resource. The PVA, I would call out, has been intimately involved with our centers since we got started, and are very knowledgeable about the service connection process for veterans that have MS. Also, in the VA side, I know typically as people are transitioning out, there's a disability exams that take place at that time across the board, and we often see people during that time frame. So if we know that there was a diagnosis or even a suspected diagnosis made, it's critically important to try to file a claim, or at least make people aware of that at the time that you are either transitioning out, or if you're still in active duty, to do it before you leave. But I've seen people do it at all different time frames. As Joel pointed out, you just have to document that you had your first symptom, and the better documentation you have in terms of medical records, the more easy it is to prove your claim. So I think this is the whole disability process to get to the service connection, is to show your documentation. Most of the records over the last roughly 15 to 20 years are electronic, so it's a little easier to retrieve them. The paper record systems were a little more challenging, but I'll just bring up one case. I was actually taking care of an individual, a veteran with MS in the late 90s, and we had gone through with the PVA representative his first symptoms, which took place during the Vietnam era in the late 60s. We found a documentation of weakness in his legs in an old active duty chart. And so he was service connected, and he got roughly 30 years of back pay. Wow. And he's living in actually a fairly nice nursing facility, and for some people, it means the difference between living in a place and being comfortable versus not. And so I think it can be a huge way forward to improve your quality of life and just pay for the needs you have on a daily basis.
Yeah, I do know that there is hesitancy with active duty members to talk about different symptoms because it could affect their job. So that's always kind of a tricky piece too, because you never know if that would be helpful in the future.
That's true.
Yeah. Dr. Culpepper, Gene was diagnosed with MS in 1995 and used a cane at the time. Now he uses a wheelchair all the time. Gene is wondering if he can get re-rated for MS disability.
I think that's an excellent question. I'm not clear from this if Gene is already service connected for MS. If he is not, then I would certainly encourage him to file, that initial claim, and so he can garner those benefits. If he is already service connected and now his disease has progressed, yes, by all means, he can refile a claim, basically having to ask for reevaluation, and again, just needs to document that his disease has progressed. Clearly, in his case, moving from a cane to a wheelchair is a pretty straightforward what it means to document that, and that the disability rating would obviously be increased in accordance with that effect. So yes, the bottom line is that with a service-connected disability, you always have the option to ask for a reevaluation as the disease progresses.
That's great. So they can really access those resources to continue to help them. That's so good. All right. So I want to talk about a significant benefits legislation known as our Promise to Address Comprehensive Toxics Act, better known as the PACT Act. This may be the largest healthcare and benefits expansion in VA history. So, Dr. Culpepper, tell us about the PACT Act and how will it affect benefits and care for veterans?
Well, you're right. The PACT Act is the single largest healthcare sweeping legislation, the VA has ever encountered, and probably, that any healthcare system within the United States has taken on it at one point in time. PACT Act seeks to do its due diligence to provide benefits to veterans that suffer from the health effects from a wide variety of military exposures, those historically going back to the Vietnam War up through those of the current conflict, that were exposed to burn pits. And so there have been, I'm not sure of the exact number, but at least 35 new presumptive conditions included in this legislation. And the advantage of making it presumptive is that there no longer needs to be proof on the part of the veteran that they were exposed, as long as they can document, and oftentimes we can do that with existing data, that they were in Djibouti next to a burn pit and they now have asthma. Well, then it's a pretty clear-cut case from the VBA's perspective that they meet all the criteria and an award would be made. It doesn't change things for MS. MS is a service-connected disability, different than a presumption, but it's still a disability, but it's not tied to a given conflict or exposure. It's just tied to, military service in general.
Wow. Well, I think it's pretty great that they're really expanding this and recognizing that maybe the impacts of those environmental conditions have on their veterans. So Anne wants to know why Parkinson's and ALS is connected to chemical exposures, but not MS.
Well, first, I think, ALS is a service-connected disability analogous to MS. So it's not tied to a specific conflict, exposure, or deployment location. Parkinson's, on the other hand, is, and there's probably due in part to some underlying differences in the pathology that leads to the manifestation of disease. I think, with MS and probably ALS, that disease process starts early in life, and as Dr. Wallin had mentioned, kind of a genetic susceptibility and then some exposure like EBV or something. But we also know that typically needs to occur during the puberty years. And then there's this long latency before, disease actually presents clinically. That, may not be the same mechanism for Parkinson's, because we have seen and observed in studies an increased prevalence of Parkinson's disease in Vietnam deployed veterans compared to Vietnam era, those that never went to anywhere in Southeast Asia. So that's why it is tied to and under the Agent Orange Act when it was in place, and to, Vietnam service. And more details about the different diseases and presumptions, can be found at the PACT Act website. I know that, those resources will be listed later.
Yeah. Wow. So Denzel says that he has MS, but it's not service connected. Is it possible that he could receive benefits from the PACT Act?
Well, that's kind of a two-pronged question. One, PACT Act would not confer any specific benefits for his MS, right? Because it does not cover. MS is separate, and he is eligible, as long as he can document symptom onset within 7 years of discharge, then he would be eligible for, having that disability claim awarded for his MS. Now, if he has other service, if he was, in the first Gulf War, if he served in, Afghanistan, then those presumptive conditions that are listed under the PACT Act for those locations, he would qualify for, and I would certainly encourage him to submit claims, for those, and because the disability rating and award is cumulative, so you can have multiple conditions, where you receive, maybe a 10% disability for this, a 20% disability for that, and then overall, that would be summed up. So it could be a substantial award made for that particular individual.
Wow. So how can veterans and survivors learn more about the PACT Act?
Well, I think the best spot is to go to the VA's PACT Act website. I know that is listed. There is a 411 number if you have specific questions and you wish to speak to somebody directly. They probably won't be able to answer you directly. Their job is to field questions and then triage those, and get you connected to the right person within the VA who can answer your question or assist with the concern that you've raised. But I think clearly, the PACT Act website, is going to be the best starting point anyway to learn about what PACT Act has to offer you.
Okay. Well, this leads us really nicely into our next topic, which is on veteran resources. So let's talk about resources for veterans and how they can access them. Now, we're going to be sharing some links and phone numbers on the next few slides, so you may want to grab a pen to write down this information. Our MS navigators will also be sharing information in the chat box. So in 2003, the Department of Veteran Affairs established the VA MS Centers of Excellence. These centers collaborate with VA providers to make sure veterans get the best care possible and have access to the variety of resources available within the VA. So Dr. Wallin, can you tell us how the MS Centers of Excellence work?
Sure. We're, like you said, we were created about exactly 20 years ago this year, and we were made permanent by the Veterans Benefit Healthcare and Information Technology Act, a mouthful. That was in 2006. And the reason we really came on the scene was that there was a number of new therapies that were approved by FDA for MS, and they weren't at least given out or administered in a uniform way throughout the VA healthcare network. So this is a way to try to deliver care for this challenging disease across the network with a hub and spoke system. And what was done back in 2003, that there was 2 centers that were awarded to help coordinate care. One called the MS Center of Excellence East, which is based in Baltimore and DC, and they basically help to manage and coordinate the care of MS in VISNs 1 through 10. Now, those of you that are in VA know what a VISN is, but it's one of the acronyms we use and throw out all the time, like in the government, but it's called a Veteran Integrated Service Network, small group of VAs. But everything basically east of the Mississippi is managed by the East Network, and then the West is based and awarded in Seattle and Portland, and they took care of the MS management in VISNs 12 through 23. So within every VISN, there is at least one, what we call MS regional program that has the FDA-approved drugs. They can deliver those drugs. They have multidisciplinary care, which includes not just neurology care, but also rehabilitation, urology, mental health care, and a variety of other things to take care of the spectrum of issues that MS patients have. So within this network, we try to really manage clinical care in an efficient way. We also have a number of educational programs, this being one of them. We also do research. So our mission is to improve clinical care, education, and research for the military veteran community.
That's so great. And like so specific to MS, that's so helpful. So how could veterans locate MS care within the VA?
So the best way is to go to the website there that you have on the screen, www.va.gov/MS. And there's a listing of MS regional programs. You can look at it by VISN where you're located. There's a map, and you can also email us at that email number to find out more. But that's usually the best way to use our web-based resources and our electronic resources to find the closest clinic location to where you are living.
Great. So veterans with MS may be eligible for VA's many programs and services, like you mentioned. Access to VA healthcare is based upon enrollment and eligibility and discharge status from active military service. So if someone is not yet enrolled, where can they learn how to apply for the VA healthcare?
So the first, I guess, there is a website for veterans to enroll in care on va.gov. That's a first step. But I would say the nearest VA to where a veteran lives, there's usually an enrollment center. In most cases, it's right as you walk in the front door, but you can ask the information counter to look for eligibility. As Joel mentioned, with the PACT Act, there's actually a pretty dramatic increase in eligibility for VA care based on exposure to time of service. And so I think even if somebody has not thought about VA care or their eligibility, I think it's worth checking out. In some cases, we will see somebody or at least be working on a presumptive service connection for MS or another condition that will allow people to access the VA. Right now, you have different categories of veterans, and it's based largely on income and era that you serve or service connection. That's usually who gets the healthcare benefits first. But like Joel said, a large increase, thousands, even millions of new veterans will be entering the system over the next few years related to PACT Act exposures or conditions.
Yeah.
And I would just add that for those veterans that deployed in support of OEF, OIF, and OND, that they now have a designated 10-year benefit for VA healthcare under the PACT Act that was raised from previous legislation from 5 years to 10 years. Now it's, those that deployed, but, that is in place.
Oh, that's so helpful for people to know that they can access these great benefits from, like rehab and neurology that the VA provides. And then is there something called the VA Extended Care Program? Dr. Wallin, can you talk a little bit about that?
Yeah. There is an extended care program, and you can qualify that based on disability service connection or VA benefits. We have a number of social work resources to direct people to some of these programs for home care. Part of it's related to your eligibility, but these are incredibly helpful resources to caring for somebody who, like MS or similar conditions that needs assistance, outside the routine daily care or inpatient care that we offer in VA.
So the Paralyzed Veterans of America, also known as PVA, improves the lives of veterans who live with paralysis. It serves with people with traumatic spinal cord injuries, but 1/3 of its members live with multiple sclerosis. So Dr. Culpepper, can you tell us about the PVA Veterans Benefits Program, and how do National Services Officers, or NSOs, and benefit specialists help veterans with their healthcare needs?
I think that they provide a very, very valuable service. The NSOs are very knowledgeable and experienced with navigating the claims process with the Veterans Benefit Administration. So that's, kind of first and foremost. They are there to act as a resource for veterans, to help them understand the requirements to meet a service-connected claim, figure out what documentation, and to pull that information together, and then physically assist them in submitting the claim and working with them through that process. So it can be daunting, for somebody to kind of work through some of the red tape, but this is a wonderful resource, to allow them to do that. They also will work with VA and other providing agencies and organizations to assist folks with getting needed things, like if they need a lift added to their vehicle, a motorized wheelchair, working again, with the Veterans Benefit Administration if they need a ramp installed at their home, or need some sort of modifications to the home to make them safe for those that may be non-ambulatory anymore. So they are a truly wonderful resource for veterans with MS, and I would encourage them to seek them out. I know the National MS Society does very similar work, in trying to connect veterans with resources in their communities, and so I think between the two of these, it really is a nice mix of services that are made available to folks with MS, not just veterans.
Yeah. Well, it's nice to know that people living with MS fall under the category of the type of veterans that they can help with. And then with that whole 7-year window, maybe that's something else that they can assist people with, making sure that they get those services in time. So what is the best way for someone to contact the PVA to get information on these programs and services?
I think the website that you have listed there, pva.org/NSO, will take them right to a listing of regional offices and NSO individuals that they can go through and select one that's close to them, and then reach out, and initiate contact and schedule an appointment, to start that process.
That's great. Well, Dr. Culpepper sort of mentioned it. So Dr. Wallin, the National MS Society has several resources to help veterans living with MS. So do you want to tell us a little bit about some of these resources?
Sure. So the MS Navigator, the program is a national call-in service where veterans or families, and even myself, I've used this to try to figure out where resources are at in a certain area for certain things. But it's a great resource, and I think over the last few years, the counselors and the people that are on the call lines have been trained not only with resources in the community for non-veterans, but also how to connect veterans, military veterans, with the VA and their related service organizations. So kudos to the National MS Society for trying to really integrate both VA and general care and resources in this one call line. So there was a number of training sessions that some of our folks here in the VA MS Centers of Excellence, the social work, and the clinicians that actually provided some talking points and resources for the MS Navigator staff. And so I think it's really worked well that we've been able to cross-pollinate a little bit. So sometimes when a veteran that maybe is not even accessing the VA network clinically, they may have a service connection benefit, but they didn't realize they were eligible for a certain resource. It can be really a nice way to fill in some of the gaps and things that they need, whether it be their home life or their maybe employment opportunity or resource regarding transportation or another type of clinical encounter that they need. It's really been a great resource.
Great.
And then we have this thing here, this Ask the MS Expert. So the video YouTube channel, which is a great resource, a number of great titles and sessions that can be accessed no matter where you live. And there's a number of self-help groups and small groups within the National MS Society, including those for veterans or other groups that may offer some unique kind of perspectives for people with the disease. And they're on the website too, that you can drill down to. So those are some of the things I refer patients to. I think, especially the Navigator program, it's very helpful for a lot of things. Just trying to figure out where you can get a wheelchair or transportation to and from a clinic, or even the nearest MS center. So
that's great. Well, I love to hear the partnership between the VA and the National MS Society, that we're really sharing information back and forth so that veterans, no matter who they get in contact with, they can really get access to resources that will really help them continue living well with MS. So that's wonderful. Well, I want to thank you, Dr. Wallin and Dr. Culpepper, for being with us today. You really shared so much valuable information about MS and the veteran community. So thank you so much for joining us today. Before we close, I would like to remind everyone that you can connect with an MS Navigator via phone, email, and through the Society's website via chat. To learn more about veterans and MS, visit www.nationalmssociety.org/veterans. You can connect with the National MS Society, the VA, and the PVA through social media channels. I do encourage you to like, subscribe, and/or get on the mailing list to continue to receive up-to-date information on MS and updates on upcoming programs. Thank you again, Dr. Wallin and Dr. Culpepper, for sharing your knowledge and for everyone's engagement in today's program. The recording will be available on the Society's website at www.nationalmssociety.org/MS Expert. I invite you to join us in June for our next Ask an MS Expert Veterans program. Lastly, it is important to get your feedback on today's program. You will see a survey linked to the comment section on YouTube. Completing the survey makes a difference, and it only takes 1 minute to complete. The information you provide helps continuously improve and shape our future segments. Thanks for joining us, and we'll see you soon.